Hi guys, I'm back. It's been a while since I've made a video. I've just been really busy, and I literally just came from clinical, so I have my hair done in a ponytail and up, and I'm just changed in like a regular t-shirt. But I just wanted to do a informative video again. I was supposed to. I know in my last video I said that I was going to do a video on clinical like paperwork and how to take care of your clinical paperwork, but I don't have that organized at the moment, so I'm just going to cover like makeup and how to fix your hair during clinical and preclinical. Um, so for preclinical, as much as possible, for us, for our school, they noted that we have to wear professional dress. So anything polo, like a collared t-shirt, long sleeve, I recommend you wear that and some slacks and maybe some flat shoes that are nice fitting. Business shoes, business attire, but comfortable, because if you're going to be in preclinical, as much as possible you want to be comfortable because you might be standing up the whole time doing your clinical paperwork, and usually preclinical takes up to, for me, my max was 4 hours, and that was with the tour when we first did preclinical, and then maybe the next couple of hours just looking for the paperwork. But as time went on and I got used to doing preclinical, it took max of 2 hours. So you want to make sure you're going to be comfortable, because you want to stay out of the nurse's way as much as possible. So you won't be sitting the whole time. I won't guarantee that you will be sitting the whole time. So as much as possible, you want to have comfortable attire, but as well as professional dress. And for us, we had a lab coat with our name tag on it. And I remember the lab coat made us look like doctors, so lots of people, like visitors, would come and ask us questions, and we'd answer them as much as we can. But usually for preclinical, you don't do any clinical work. You're basically getting all your information on the patient that you're going to be taking care of the next day. And for hair, we weren't really told to do anything with our hair. We could have had it down or up in a ponytail or in a bun, as long as it looked clean and professional. So usually I had it down, and there was my instructors didn't have any they weren't really picky about that during preclinical, and usually they weren't there. Only on the first day when we first were getting used to the clinic that we were going to be in, or the hospital that we were going to be in, and usually on the just usually in the first week. But other than that, makeup-wise, for preclinical and clinical, as much as possible, try to keep it simple. You're not trying to go for anything related to going out to party or going out to the bar, so as much as possible you're just going to be taking care of patients, so they don't really mind how you look as long as you look clean and you're there and you look happy to take care of them. They won't really mind in how you look. You also just want to look professional in your scrubs, whatever you're wearing. Have your hair up as much as possible, especially during clinical. You're going to want to have your hair, if your bangs are longer than mine, you're going to want to have them pinned up with a bobby pin and out of the way, so you're not having your hair down in the patient's area or in their bed or on top of them, and that would get your hair dirty and would be a disturbance while you're taking care of your patients. As much as possible, have it up in a ponytail, I recommend, or in a bun, and clip any excess hair that you have out of the way. And then for makeup, as much as possible, I didn't really wear as much makeup. I usually I rarely wore foundation. Usually I wear foundation when I'm going out for a longer period of time. But for clinicals, since you're always in a rush early in the morning for clinicals, I try to keep it like a bare minimum. Once in a while I did wear foundation, but those were rare times when I had extra time. So the foundation that I use Maybelline's Instant Age Rewind foundation, and I usually use that and use like a sponge to put my makeup on. I'm not really like a professional with being like all makeup and beauty guru. This is just my way of doing my makeup for clinical and how I do my makeup. So I might be wrong, but whatever. Instead of using foundation, I use a tinted moisturizer, and I use the Aqua CG smoothers, and I'm in the shade 810 light to medium. And this is really good if you don't want something too heavy, especially in the morning when you're not really looking to look super pretty. You're there to take care of the patient pretty much. And I pretty much use this, and if not, if I don't use this, I would use just plain old concealer under my bags, under the bags under my eyes, and on my T-zone. And where I have redness around my nose, I use concealer. I use the Instant Age Reminder Eraser Darker Circles. And this isn't concealer, this is a decreased eyeshadow base. I just use this over my eyes because I use eyeliner for clinical. And then I also use sometimes primer if I'm using like foundation or the tinted moisturizer. But recently I've kind of stopped using the tinted moisturizer and kept it at a bare minimum. I've been using this new Misha BB cream. If you don't know what BB cream is, Google it. It's kind of like a mix between foundation and tinted moisturizer. So it's pretty light and it has pretty good coverage. I have Misha, the Misha one, and then it came with it in a travel set, and it came with the BB Boomer brightening moisturizing Misha BB Boomer, and this is kind of like a primer, but it brightens your complexion as well. So you put this before you put the Misha BB cream, and I'm in the number 23. This is just a smaller travel size one, 10 milliliters. And usually I just use this to go on my redness around my nose and under my under eye circles, and it's pretty good. Right now that's what I'm using. That's all I use, and then I just put that decrease shadow base, and then I just put eyeliner on. Revlon Color Stay eyeliner, and that's pretty much what I wear. And it just keeps me going, and it looks like the bare minimum, and it's natural. And I think that's the best way to go when you're doing preclinical or clinical. You're not going for anything dramatic. It's not like you're going to be going to a party or anything. You're just going to be taking care of your patients, and I think it's the best way to look, not too overdone. So that's what my regimen when I use makeup, and it's pretty simple and makes me get through the morning faster. And I also straighten my hair and then just put it up in a ponytail or a bun. And I usually recommend, if you have really long hair and you don't have any bobby pins or clips to hold it up, get one of these elastic bands to hold your hair back, and these will stay for the full amount of time that you'll be in clinical. Probably have to adjust it once in a while, but these are good to go. And then this headband, in case you don't have any of the elastics, try a headband. This will help you out a lot. But yeah, I recommend you also always use primer and cover your dark eye circles, because you will probably have under eye circles after a long night of preclinical. So you might want to just cover that up. Besides that, I think you're pretty good. As long as you have and don't forget the accessory of having your smile and getting through that day of clinical. But that is basically the makeup that I use and what I do for my hair to get ready for clinical. And preclinical, you can put a little more makeup. You can actually wear foundation, but know that when you're going to be there for a couple of hours, and then you still have to head home and do all your clinical paperwork. So you're probably going to have to clean that all off and spend most of your night working on your clinical paperwork. So I recommend not wearing too much makeup either, because you're just going to end up cleaning up anyways, and you're just there to get patient information and not really visit your patient as long as during clinical. But that's just my input on makeup and hairstyle for clinical and preclinical. Let me know if you guys have a different way of doing your makeup and hairstyle for clinical and preclinical. I'd like to hear about it. But hopefully for the next video, I'll be doing one on clinical paperwork. So look out for that, and I'll talk to you guys later. Thank you for watching. Bye!